Hey guys, I'm going to show y'all how to use your mouth mirror in this video and also how to set up the typodonts and poles that we're going to be using in clinic this afternoon. So you need two pieces of equipment to set up a typodont. One is a cover pad so we don't scratch our chair, and the other one is going to be our poles, and your typodonts will be attached at the other side of it. So with your chairs, there's actually a button right here on the side that I can push, and when I do, it can move the headrest. So I'm going to push the button in and move the headrest. I can actually make the headrest go up and I can make it go down. So when I set up a typodont pole, I'm going to want this in the down position. So what we're going to do is we're going to take our purple pad, position around. We're going to take our metal pole and slide on. Here we go. Underneath of here is a screw where you can tighten the pole. You'll see me going clockwise here until it tightens down. Okay, the next thing I want to show you is the way to get your typodonts on and off this pole. So there is a screw right here on our typodonts, and it loosens and tightens, and what we're going to do is we're going to slide the pole through the hole that's provided here. Slide on, and when you get this mouth in the position that you want it, go ahead and tighten as tightly as you can, because we're not going to touch or mess with this screw again. There we go. So if we want to move this mouth either towards me or away from me, there's a lever right here, and this is the lever we're going to use to move our typodonts from here on out. So what I'm going to do is loosen the lever, and you will see that the typodont now can move towards me, and it can easily move away from me just by rotating the pole. So I don't need to touch my typodont again. So I'm going to have my typodont at an angle like this. I'm going to tighten down so now it won't move on me. And I'm going to show you guys how we're going to use a mouth mirror. So I'm going to go ahead and grab my mouth mirror. Now I'm a right-handed clinician, which means I'm going to always be holding my mouth mirror in my non-dominant hand, which would be my left hand. And anytime you are using a mirror, the one thing you want to avoid on your patient is striking the teeth as you're putting the mirror in their mouth, because this is metal and it won't feel good to patients. So you're always going to want to establish a stable and secure fulcrum. So when you have a fulcrum, you can now have freedom to move your mirror where you need it without fear of hitting your patient's teeth. So when you insert a mirror, you establish a stable and secure fulcrum. You insert the mirror in a spoon-like fashion. I can do that again. Fulcrum. Insert in a spoon-like fashion, being careful to avoid striking the patient's teeth. So from this point, I can now visualize all the areas of the mouth that I can't physically see with my own eyes. So one of the things we're going to have you guys do is demonstrate how you see the facial of all of the different quadrants of the mouth, particularly the posterior teeth. So let's start with the upper right. We're going to insert our mirror into the back of the cheek, and we are going to retract back. Now when I do this, I have visual sight of the upper right facial teeth. I can retract back, do the same thing for the upper left, inserting, and do you see how I'm inserting in a spoon-like fashion? Getting a fulcrum, pulling back in the cheek, and pulling the cheek backwards, so I can now look at these upper left teeth through my mirror, and we call that indirect vision. Let's drop down to the lower left. Same thing will occur. Insert the mirror spoon-like fashion, press the mirror against the cheek, retract back. Now I can visually see the lower left facials. Dexter's cheeks are a little sticky. Now I can visually see the lower left facials. Let's finish with our last quadrant, which will be the lower right facials. Insert in spoon-like fashion. Press on the cheek. Pull back for direct visualization of the lower right facials. Now this is for a right-handed clinician. Now, the other thing that we can do with our mirror is indirect vision, and I'm going to demonstrate that first on the maxillary anterior teeth. So you'll see, as a right-handed clinician, I can palm my mirror to directly pull back the lip, and I can visually see all of the upper anterior teeth. And I cannot see the lingual teeth, the lingual surfaces of the anterior teeth. So I'm going to take my mirror, establish a stable and secure fulcrum, insert my mirror in a spoon-like fashion, and I can now visually see the upper anterior lingual as a right-handed clinician. And same thing on the mandibular anterior teeth. Establish a stable and secure fulcrum on the lower arch, insert my mirror in a spoon-like fashion, and now I can use my mirror to see the linguals of the mandibular anteriors. As a right-handed clinician, the other area that's very difficult for us to see is the lower right linguals. If you are a lefty, you will have the same issue on the lower left linguals. I cannot visually see those teeth. On the lower right, the only teeth I can visually see are the posteriors on the facial. To see the linguals, I'm going to have to insert my mirror first with a fulcrum to see my lower right linguals. And if we back up the camera a little bit, you can actually see where I'm sitting. I'm actually about 10 o'clock. So for lefties, you guys would be about 2 o'clock here. I'm fulcruming on the lower left to visually see the lower right linguals. The other area that's difficult for right-handed clinicians to see, if not almost impossible, is your upper left facials. If you're a left-handed clinician, you'll have equal trouble seeing the upper right facials. So to actually work on those teeth, we're going to have to use indirect vision again. So what we're going to do is we're going to take our mirror, we're going to slide back on the upper left, pull the cheek backwards, and I can now see the upper left facials through my mirror. Left-handed clinicians, you should be doing this on the upper right. Anytime you're not actually using your mirror for indirect vision, what you're going to do as a clinician is you're going to take your mirror from a modified pen grasp and you're going to establish a palm grasp. So at this point, I can actually free up my non-dominant index finger to physically pull back tissue so I can see teeth. So your mirror can either be palmed when you're not using it for indirect vision, or you can simply place it on the tray and grab it as needed. The very last thing I want to show you guys with the mirror is indirect illumination. And we also talked about transillumination in our lecture. So I'm actually going to grab the overhead light, and when I turn it on, you guys aren't going to be completely able to see what I'm doing in the mouth, but I'll verbally walk you through it. So what I'm going to do is grab my light, and remember, for maxillary teeth, positioning of the light, remember we're coming at about a 60-degree angle on the mouth, and I'm going to show you illumination on the maxillary arch. So we're going to insert our mirror with a fulcrum in a spoon-like fashion. And as I'm indirectly looking at the upper maxillary linguals, what I'm going to try to do with my overhead light is actually catch the light to illuminate the area that I'm looking at. And transillumination means I catch that light through illumination, and instead of looking on the linguals of the teeth, I'm actually going to look on the facials of the teeth to now basically be able to see through teeth to see if we have any, dark areas, cracks on teeth. So I'm catching the light on the lingual and visually looking at the facial of the tooth when I am using trans illumination. So that's y'all's assessment this afternoon on the mouth mirror and how to correctly set up a typodont. And that is it.